Hello everyone. In this module, we continue from where we had left. Growth and anthropometry part 2. We'll be talking about some of the less commonly used anthropometric measurements, their interpretation, and we'll be discussing the dentition and bone age concepts. So, what are the other anthropometric measurements that are less commonly used but still important from entrance point of view? One of them is an index called as stem stature index. In short, it is written as SSI. Stem stature index is not mentioned in OP Ghai or Nelson, but it is mentioned in the other textbooks, including textbook by Dr. Suraj Gupte. It is also there in IAP textbook of pediatrics as well as many clinical manuals. So what is the stem stature index? If you remember, in the previous module, we had talked about upper segment to lower segment ratio, and there I had told you that upper segment refers to the height from top of head till midpoint of pubic symphysis. It is also called as sitting height or crown rump length. So stem stature index refers to sitting height, that is upper segment divided by total height multiplied by 100. So this is the stem stature index which is used. So what is the interpretation? As age advances, the upper segment to lower segment ratio tends to fall down. So SSI index also tends to fall down. So first is SSI value at birth, it is found to be 70. At 6 months, it becomes 66. At 1 year, it becomes 64. At 2 years, it becomes 61. At 3 years, it becomes 58. At 5 years, it becomes 55. And at the time of puberty, usually SMR stage 3, it is found to be around 52 in case of adolescents. So this is the stem stature index that we follow. Around 50 of stem stature index then is found in most of the adults. 50 or just below 50 is the value in case of adults. So you can remember, in case of adults, the stem stature index is equal to or less than 50. This is the point to remember regarding the stem stature index. Next we move to triceps skin fold thickness. Triceps skin fold thickness is a technique to measure subcutaneous fat in case of children. Now skin fold thickness can be measured at 3 parts. First is biceps, second is triceps, and third is the interscapular area. But in case of children, the best site is triceps skin fold thickness. To measure triceps skin fold thickness, we have two types of instruments which are available. There are two methods to measure skin fold thickness. One is using a set of method known as Herpendon's calipers. And second is the Lange's calipers. Herpendon's calipers are the one which are available at most of the medical colleges, and this is the one which is frequently used in case of children. Herpendon's calipers, photograph can be asked in the exam. What is this instrument? This is what Herpendon's calipers look like. Herpendon's calipers checks for triceps skin fold thickness, and if it is found less than 10 millimeters, it indicates undernutrition in the child. But better way is using the age related normograms rather than a single value. But in general, less than 10 millimeters is taken to be undernutrition in case of children. Now another point to remember here is that more accurate index of body fat is a ratio of total body water divided by body weight, that is TBW divided by body weight. However, it is difficult to do accurately in children, and so it is not very frequently performed. So what we do is the triceps skin fold thickness measurement. Moving over to the concept of bone age. Now there are many types of ages we'll be discussing, particularly when we discuss the topic of short stature. But there is one thing called as chronological age. What is chronological age? Age according to your date of birth, the true age is called as chronological age. That is one thing. Second is your bone age. Bone age refers to age of a person or a child based upon the skeletal maturation. So what is bone age? Bone age refers to age assessed According to bone maturity means number of ossification centers or epiphyseal centers which are present. So any age according to bone maturity is called as bone age. So if I have to calculate chronological age, I will take date of birth and I will calculate it. If I have to do bone age, it may or may not correlate with the chronological age. I will take X-ray of the bones and apply specific methods to calculate the bone age. In a normal person, in a normally growing child, bone age and chronological age go hand in hand. They are virtually together and the same. But in a child with short stature, it is often found that chronological age is more and bone age is less, with some notable exceptions. So what are the methods to calculate bone age? We perform a X-ray of the bone and then use two types of methods which are available. The names of the methods are important. They can be asked in super specialty entrance exam. First is the Grulich and Piles Atlas method, and second is the Tanner Whitehouse method. Any of the two can be used, but both of them require taking of X-ray. Now the question arises, which X-ray should be taken? It depends upon what the age of the child is. So what are the sites for bone age determination by X-ray? Which X-ray you should be taking? Potential MCQ for super specialty exam. In case of newborns, we go in for foot and ankle. In case of 3 to 9 month age, we go in for shoulder X-ray. In case of 1 to 12 years, we do hand and wrist X-ray. And in 12 to 14 years, we take X-ray of elbow and hip. They are very frequently asked in entrance exam, and you must remember which bone to use. They are of importance in your practice also when you are, if you are into general pediatrics, if you are into endocrinology and seeing a lot of growth retarded individuals, then calculation of bone age is important, and which X-ray to advise is also equally important. Now, what is the significance of bone age? Bone age refers to the skeletal maturity of an individual. In most cases of short stature, it is found that the chronological age is greater than the bone age. However, there are a few exceptions here. In case of a condition called as familial short stature, which runs in the families, a type of physiological short stature, as we shall discuss. We have discussed it separately in a separate module. So familial short stature, the chronological age is equal to bone age. And there is another MCQ point. You can remember that there are certain conditions called as precocious puberty as well as thyrotoxicosis, where bone age may exceed the chronological age. While precocious puberty as a cause is mentioned in OP Ghai also, other textbooks mention thyrotoxicosis also in case of children as a condition where bone age may exceed the chronological age. So statement based questions and fact based one-liners can be asked based upon this bone age. Now, related to bone age, at birth, you should know that there are 5 ossification centers which are present. First is the distal end of femur, second is proximal end of tibia, third is talus, fourth is your calcaneus, and fifth is cuboid bone. So this question, again a one-liner, can be asked. All of the following ossification centers can be present in a child at birth except. So that is how this small table can be asked in your exam. Next we come to the time frame of appearance of ossification centers in the carpal bones. Now the carpal bone, if you look at the carpus, the wrist X-ray of an adult, it looks something like this, where all the ossification centers are normally present. So what we are interested in is looking at the various carpal bones. So these are the 5 metacarpals, right? We are not interested in that. This is the radius and ulna. We are not interested in that. It is the central part we are interested in. So we have capitate bone here, which is the first bone to appear in carpus. Then adjacent to that we have the hamate bone, then we have triquetrum, we have pisiform. Pisiform is not visible as a separate bone. On X-ray it looks like a part of the triquetrum only. Then you have the lunate, we have scaphoid bone, we have trapezium, and we have trapezoid. So these are the carpal bones which are present. So the first bone to appear, the first bone to ossify after birth is capitate bone, which ossifies around 1 to 3 months. So it becomes visible on X-ray between 1 to 3 months. So some of the things, if you try to Google search, some of the sources will say that hamate is the first bone to appear, which is wrong. Hamate can be the first bone in up to 5% of individuals, but majority of children worldwide, and as well as looking at references like Nelson and Textbook of Pediatrics by Dr. Suraj Gupte, they all say that capitate is the first bone to ossify. So among the carpal bones, so capitate appears at 1 to 3 months, hamate appears at 2 to 4 months, triquetral appears at 2 to 3 years, lunate again appears at 2 to 4 years, scaphoid at 4 to 6 years, trapezium at 4 to 6 years, trapezoid at 4 to 6 years, and pisiform appears late at 8 to 12 years. So this is the sequence you are supposed to remember. Sequence can be asked in super specialty entrance exam. Now a useful point. Number of ossification centers at the wrist. If somebody asks you what is the number of ossification center at the wrist, remember it is age in years plus 1. So if somebody asks you what is the number of ossification centers in a 2-year-old child, how many centers will be visible? So the answer will be 2 plus 1 equal to 3 ossification centers will be visible at the wrist. So this is something, just a simple numerical thing you can remember. Coming to dentition in case of children. Dentition in children is broadly of 2 types. You have the deciduous teeth, also called as temporary dentition, and we have the permanent teeth or permanent dentition. The deciduous teeth are 20 in number, whereas the permanent teeth are 32 in number. This number is variable depending upon how many wisdom tooth you have, but 32 is the general consensus that we take. Regarding temporary teeth, remember that the first temporary tooth to arise is the incisors, and they arise, they erupt somewhere around 6 to 7 months of age. And every monthly you have one tooth erupting, so that by 2.5 to 3 years of age, you have all 20 teeth present in most of the babies. So this is one thing that you need to know. You may get an MCQ based upon this fact. The question may ask you, what is the number of teeth expected in a normal infant aged 10 months? Options will be 2, 3, 4 and 6. To solve question like this, remember that there is a formula for that. Number of deciduous teeth in infancy is given by the formula age in months of that child minus 6. So what is the age here? It is 10 minus 6, so the answer is 4. So number of deciduous teeth in infancy, because there is a reason for this. Deciduous teeth first erupts at 6 months and then one tooth is erupting every month. So number of deciduous teeth in infancy will be age in months minus 6, total coming out to be 4. So answer to this question is 4 teeth. Such questions are seldom asked in exams, but when you are preparing for super specialty, every question is important and you need to be prepared for questions like these. Next, we have the sequence of primary dentition, which is the first tooth to appear, which is the next tooth to appear, and so on. You may get one-liners based upon this, or you may get questions where they ask you what is the exact sequence. So on one side we have the age, and other side we have the tooth getting erupted. So at birth, no primary dentition, no teeth are present, right? At 6 to 7 months, the first teeth to erupt are the central incisors, which I have already told you. At 9 to 10 months, you have the lateral incisors coming up. Then 12 to 18 months, you have the first molars coming up. Then 15 to 21 months, we have canines. Canines are also sometimes called as cuspids. 2 to 3 years, you have the second molar teeth which are erupting. Premolars are not present in primary dentition. Coming to secondary dentition or the permanent teeth. Remember that first permanent tooth to erupt is the molar tooth. It is not incisors. First temporary tooth erupts at 6 months, whereas the first permanent tooth erupts at 6 years of age. So at 6 to 7 years, the first tooth to erupt is first molars. 7 to 8 years, you have the central incisors which are erupting. 8 to 9 years, lateral incisors erupt. 10 years, you have the first premolar which erupts. It is also called as anterior bicuspid. 10 to 11 years, you have the second premolar, also called as posterior bicuspid. This is posterior. You can change it here. This is posterior bicuspid. Then 11 to 12 years, you have canines which are erupting, and 12 to 13 years, second molars, and finally 17 to 25 years, the third molars erupt, which is also called as the wisdom tooth. Wisdom tooth has got nothing to do with the wisdom of a person, and some people don't have this tooth erupting at all, and in certain other people it erupts obliquely or gets impacted and creates a lot of issues, as is the case with me. My one of the wisdom tooth is impacted and it often creates a lot of problems, but I am trying to avoid a dentist visit as much as possible. That is what we doctors also do. We keep putting it off till it becomes unbearable, and then we have to go in for extraction. But third molar is the wisdom tooth. Time of appearance is variable and may or may not erupt in all individuals. So this is the sequence of secondary dentition. What is important for these two tables which I have showed you is, first, you need to know which tooth is erupting at what time. Secondly, you should know the sequence. Primary में the sequence is different, secondary the sequence is different. So this is what you need to remember. Let us move ahead. What are the abnormalities in dentition? Now, first thing, before I start with the abnormalities in dentition in children, there is a lot of saying. Common Indian saying is, whenever a child is having tooth eruption, due to eruption of teeth, child will be irritated, child will have fever, and child will have diarrheas. This statement is only partially true. Yes, children who are having eruption of tooth, they may be irritated, they may be having drooling of saliva, there may be sleep problems in these children, and there may be decreased feeding also. But tooth eruption itself does not cause fever, it does not cause diarrhea. The increased frequency of diarrhea and fever which is seen in these individuals is related to the age at which the teeth are erupting. If you recall, most of the deciduous teeth, the temporary teeth, are erupting initially between 6 months to 1.5 years of age. This is also the time when the child is now receiving complementary feeds, the effect of maternal antibodies is going away, and exposure to various virus, bacteria and protozoa is now becoming predominant. And so some temporal correlation may be observed, which is not correct, that the child now is having tooth eruption, so is having diarrhea. They are mood changes and appetite changes can happen, but diarrhea and dysentery and fever episodes are more related to simultaneous infection rather than the dentition itself. So this is something you pediatricians already know, but you need to counsel the parents accordingly. Now, what are the abnormalities in dentition from entrance point of view? First, you have the natal teeth. Natal teeth are also called as predeciduous teeth. Some children are born with teeth. They have eruption of tooth even in the neonatal period. We call it as natal teeth. Natal teeth by itself is not a problem. It is considered a self-limited phenomena and they tend to go away in a few days. Natal teeth can be a normal variant in most cases. Sometimes natal teeth can be a feature of some syndrome. A lot of syndromes have been described, including Pfeiffer syndrome and various ectodermal dysplasias, and it has also been associated with congenital syphilis. But in vast majority, it is considered to be a normal variant and does not cause any problem. So first is natal teeth. Second, you have anodontia. Anodontia means complete absence of teeth. Complete absence of eruption of teeth. Anodontia is defined only at or beyond 18 months of age. If no tooth has erupted at or beyond 18 months, beyond that period, till 2 year, 3 year, whenever the child comes to attention, you use the word anodontia. It is a rare thing, but it is often associated with a group of conditions called as ectodermal dysplasias, which can be a potential MCQ. Third abnormality is delayed eruption of teeth. Teeth are erupting, but they are delayed. Delayed eruption of teeth is defined when there is absence of tooth eruption till 13 months of age. Teeth have erupted, but after 13 months, we call it as delayed eruption of teeth. There can be various reasons for delayed eruption of teeth. What are the various causes? According to Nelson, the most common cause of delayed eruption of teeth is idiopathic. No cause can be found. Other causes include protein energy malnutrition. It can occur due to rickets. It can occur due to hypothyroidism. It can occur due to dysplasias like bony dysplasias like achondroplasia. And it can occur due to osteogenesis imperfecta. So these are the common causes of delayed eruption of teeth. Then there is a thing called as yellowish discoloration of teeth. Yellowish discoloration of teeth can occur in two scenarios. It can occur due to tetracycline use in children, or it can occur due to fluorosis. Sometimes fluorosis can also produce yellowish discoloration of teeth in case of children. Then is one-liners you need to remember, that the mineralization of teeth starts from the crown and proceeds downward. So it is the top to bottom mineralization which happens. Exfoliation of deciduous teeth begins at about 6 years. So falling of the teeth of all those teeth which were temporary, and it starts at around 6 years and continues till about 12 years of age. Many children, some variations can be seen. Normally what happens is 6 months of age onwards, you have the first tooth appearing. Okay, the first temporary tooth. By 2.5 to 3 years, all the temporary teeth, that is 20 teeth, have erupted, right? 3 to 6 years, the child will not have any new teeth coming or the older tooth falling out, right? 6 years onwards, two things will happen. The exfoliation means falling of temporary tooth will start. Simultaneously, new teeth will start coming. Often it is found that these two processes either occur together or there may be a gap of around 6 months between the two. There is a small subset of children in whom the permanent teeth may erupt before the falling of the deciduous teeth. They may appear behind or in front of those as well. Nothing needs to be done, although it may sometimes require a dentist opinion, and some spacing of the teeth may be a problem in some of these children. So 6 months of age onwards, temporary teeth start. 2.5 to 3 years, all temporary teeth are present. 6 years of age onwards, temporary teeth start falling down and permanent teeth start coming in. By 12 years of age, all temporary teeth have gone away. These are the facts that you need to remember, right? Now, what are the causes of early exfoliation or early fall of teeth before 6 years? Given in Nelson 21st edition, was not there in older Nelsons, and it is not there in OP Ghai. So it is an important thing for your super specialty. First thing is hypophosphatasia. Second reason is Langerhans histiocytosis. Third is leukemias. Fourth are trauma. Fifth is idiopathic. And sixth is cyclic neutropenia. So these are the causes of early exfoliation starting before 6 years of age. Finally, we come to some MCQs including the visuals on teeth in congenital syphilis. There are three tooth abnormalities which can be seen in congenital syphilis. First, you can find natal teeth in some of the patients of congenital syphilis, but they are rarely seen. The second teeth which are found in congenital syphilis are a kind of hallmark finding. We call them as Hutchinson's teeth. What is Hutchinson's teeth? Hutchinson's teeth refer to notched, widely spaced, peg-like central incisors. If I have to show you a picture, this is how the picture looks like. Potential visual. Look at the image, tell the likely diagnosis. These are peg-like, widely shaped, notched incisors which are seen in congenital syphilis. They are called as Hutchinson's teeth. And the third abnormality which you find in teeth in congenital syphilis is mulberry molars. Mulberry molars refers to extensive, prominent cusps which are more than 3 to 4 in molars. Usually the first molar is involved, sometimes the second molar can also be involved. Look at this picture. Can you see the extensive mulberry-like lobulated prominent cusps which are present in this teeth as well as this teeth? These are called as mulberry molars. So natal teeth rarely, Hutchinson teeth very often, and mulberry molars again very often are seen in congenital syphilis. You may get one-liners or you may get visuals based upon these abnormalities.